Hi, everyone. I was about to say happy Monday, but today is Wednesday, February 17th. Mobile County Health Department was closed Monday and Tuesday. Those are traditional holidays for us so that our employees can celebrate Mardi Gras. Of course, things were different this year. Um, so I hope that everyone had if you were off on Monday and Tuesday for Carnival, I hope that you were safe and stayed safer at home. Um, Today, we're reporting on 35,155 cases of COVID 19 in Mobile County. We added 51 yesterday, 54 on Tuesday, 111 on Monday, and in the low hundreds and 80s over the weekend. So, this is continuing a downward trend in the number of cases of COVID 19 after our record high spike of COVID cases, hospitalizations, and deaths, and cases in December and January. And now we're seeing the effect of that on deaths. Those death numbers usually lag behind. So we are reporting 690 deaths. Two were added yesterday. And the total number of people hospitalized with COVID 19 in Mobile County is now at 4,525. 14 new hospitalizations were added yesterday. And then that indicator that we look at daily, the number of people hospitalized on any given day with COVID 19 diagnosis yesterday was 135. That was down 9 from the day before. So that number has steadily dropped over the last, couple of weeks, where we are for the first time in a few months below 140 hospitalized in any given day in mobile hospitals. So this is really good news for our hospitals that we're back down to about half the number of COVID patients as we were during the peak in December and January. So just to give you a little bit of update from our weekly report that was just sent out by our public information officer, I just wanted to make sure that you look at a couple of things that we only report weekly. So by age groups, things are looking about the same. By sex, the same. By race, the same. Overall, looking not much different than we have seen. I will say that when we look at the number of deaths, this is figure 8, you can see that in January we had a much higher number of deaths reported to us, but that is due to the high number of cases. It's not, any increase in the death rate. And actually, when we look at deaths as a percent of all cases reported to us, in the month of December and the month of January, the percent of COVID cases who died with COVID-19, or at least that we know about already, was a little less than 2%, which is our average for this entire time. Overall, we have a 2% death among cases. So in January and December, it looks like it's about normal. Although the number of cases is much higher than we saw in the spring and than we saw in the summer. Actually, the percent of deaths was higher, much higher, in April and May of last year compared to now. So we have things that are assisting us and keeping that percent of death down. So we have treatments available to us now that are very helpful with keeping people from the most severe illnesses. And then we have vaccine on the way to try to protect people from disease, severe disease and deaths. So that's all good news. Also, we report on Monday in our Monday report the sort of overall percent of laboratory tests that are positive. So this has also been going in the right direction. It's down to calculated this week for last week, the week ending February 13th, the percent positive test result was 7%. Now, having said that, we know for a fact that when we look at percent positive for PCR compared to antigen test, we have consistently a lower percent positive of PCR test, a much higher percent positive in rapid test, because in general, people who are sick or who've been exposed, they want to get a rapid test for COVID. and more sort of biases those numbers a little bit, that the PCR takes a day or two to come back. We sometimes bias that to using PCR on people who don't have symptoms or who aren't at high risk for COVID disease. But don't fret, either test is good, and we have plenty of testing capacity in Mobile County. So please, if you want a test, need a test, think you have COVID, please call to get a COVID test at no charge to you at any of our 8 locations at the Mobile County Health Department by calling 251-690-8889. So when we look at the geography, we still are seeing our highest rate of COVID transmission in the last 2 weeks in the 36572 area code. I believe that is the Saraland, Satsuma, one of those. I think maybe Saraland. So in that area, we're still seeing the highest numbers of transmission, even though it's low. So again, just to kind of just to remind you that yes, things are looking good, looking better than they did in December and January. But even with the number of cases reported last week, which was around 750, 760, that number of cases by week still is, those were the levels that we were seeing in November. We still have not returned to levels that we were seeing in late August and early September, which is where we had the most preventive measures in place. So you can look at the data and see that when a mask mandate is in order, when there are restrictions on gatherings, and are restrictions on occupancy in restaurants and bars, and when there are restrictions on occupancy in retail situations, when schools are out, that is when we see the lowest amount of community transmission. So I realize that we're not going to go back to those rather austere limitations on our movement around the county, but it puts more responsibility on you as the person to make sure that when you are outside of your home, that you are wearing a facial covering with 2 to 3 layers, that it fits well, and that you wear it properly, that you are distancing yourself from from people that you don't live with, that you are washing your hands and staying at home if you're sick. These are really important if we're to continue trending downward in the number of cases, hospitalizations, and deaths. It's even more important now because you will see in a news release that will come out probably around 3 o'clock, as soon as we're done with Facebook Live, that the Mobile County Health Department, in collaboration with Mobile Laboratories, so with Coast Diagnostics and Synergy Laboratories, who are Mobile-based laboratories, the County Health Department has confirmed the first Mobile County resident, an adult, who has been, where the highly infectious COVID-19 variant B117 has been identified in a Mobile resident for the first time. So this person is doing well. We have other household members and other close contacts that we are following closely to try to limit spread, and also to try to get them tested so that we can see if others who have been potentially exposed have the UK variant, the B117, that was identified in a Mobile County resident for the first time. And I believe the Alabama Department of Public Health is also going to announce maybe a couple other counties where highly transmissible COVID-19 has been detected at 3 or about the same time that our news release goes out. So just remember that the variants, particularly this B117, the UK variant, is more contagious than the parent strain, than SARS-CoV-2, and it's been detected in at least 44 states. CDC says there are around 1,277 cases of the United States. So it should not come as a surprise that the UK variant has been detected in a Mobile County resident. It's probably been here for some time, but we have, with the state health department and our local laboratory partners, been working to expand the surveillance that we do for these variants to try to conduct more genetic sequencing so that we can know which variants are circulating in Mobile. So again, just, expected it to happen, but today announcing the first detection of highly transmissible COVID-19, the UK variant B117, in a Mobile County resident. And more to come on that. This is a preliminary report because it is an ongoing investigation, and we are continuing to follow up on contacts to make sure that everyone is isolating and quarantining as they are required to do, and they are in total compliance, and we're very thankful to their cooperation. We're also greatly expanding testing in the close contacts and the households and the family members around this patient. And as we learn more about this cluster, we will let you know. All right. So also today, MCHD released just some information, just sort of celebrating the mass vaccination clinics last week, and for people who were eligible. MCHD, had been monitoring this. We participated in this testing event ourselves by giving some first doses at one of our locations last Monday. So ADPH, the Alabama Hospital Association, our local hospitals worked together to get more than 24,000 vaccines in the arms of Mobile residents or people in Mobile last week, between public health and local hospitals and drive up and walk-ins and appointments and no appointments. That's a real win for Mobile County when that many people can get vaccinated in 1 week. So our health officer, Dr. Eishold, says many thanks to all of those who participated, and don't forget that even if you have vaccine, you still have to wear your mask and socially distance. I think any day now you will see ADPH will modify its quarantine and isolation rule to adopt what CDC has recommended, that if you have received 2 doses of vaccine and it's been more than 14 days but less than 90 days since your second dose, you do not have to quarantine if you are exposed. This also applies to anyone who is COVID positive. Within 90 days after the COVID positive, you're not required to quarantine if you're exposed. I believe that the state will be publishing this any day now, and as soon as they do, we will begin adopting and begin, suggesting that people who meet those criteria do not have to quarantine. And the 90-day is based on a couple of things: what's known about natural immunity, what's known about immunity induced by vaccination, and also the threat of variants. So the data and science are still being accumulated on how testing, vaccination, and treatment are affected, if at all, by any of these variants. So again, we know they're more highly infectious, but the science is still building on their effect on testing, treatment, and vaccination. So stay tuned. Our team is over at the cruise terminal today giving second doses to several hundred people. We're really excited about that. The health department still has no first doses to administer, but as soon as that changes, we will let you know about any potential new first dose clinics by posting it on our website at mchdcares.com or changing our recording at 251-410-MCHD. So I hope everyone had a safe Mardi Gras. If you did get out and about in Mardi Gras, stay at home to the greatest extent possible for the next 2 weeks, so that if you were infected while you were out celebrating Mardi Gras, you can keep that infection to yourself. So stay safe, everyone, and we'll talk to you again tomorrow.